We're back with today's health and the most common cancer in the United States.
We are talking, of course, about skin cancer. 1 million new cases are diagnosed annually. The good news is it is one of the most preventable cancers. Nanette Burkew and Dr. Elizabeth Tanzi share their personal stories in this month's Self magazine. And our friend Lucy Danziger is the magazine's editor-in-chief. Welcome to all
ladies.
of you.
Thank you for having us.
A great idea to put this in the issue because it is one of those things that I think, even though we talk a lot about sunscreen and all that, people still overlook it, don't they, Lucy?
It is definitely preventable, and the good news is it's also curable. Yeah. So if you go to a doctor and you get a mole check, you're going to be in good shape. But the first thing we want everybody to do is wear sunscreen year-round, because incidental sun damage is going to add up, and that's what's going to cause you the skin cancer in the end.
Sure. And you say that the only safe tan is a
fake tan. Yes, I like to be bronze, and I will tell you that you can get it out of a bottle just as well, and you're not going to cause the skin damage. Don't go to those tanning beds. That's the equivalent of smoking. I mean, you're really adding the carcinogen.
In fact, what is the ratio of people who develop skin cancers is quite a bit higher for people that use the tanning beds, right?
Well, and we know in your lifetime you've got a 20% chance of getting skin cancer of all variety. But today we're really focusing on melanoma, which is the deadliest kind of cancer.
And Nanette, were you one of those people who sat out in the sun with the reflectors and did the whole thing?
You know what? I didn't. I live in California, so every summer I'd go to the beach and I'd peel a new nose every summer.
So how did
is that where it came? Then that's where you got the...
It isn't, and that's the ironic part. I mean, I'm head to toe freckles and moles, so to be able to find my own stuff is hard. So I rely on my dermatologist. I get checked every 2 months, and
it's not just something you see; it's a full body check that you get.
It's a full body check. I get photographs. I get everything because I can't find it. The one that was melanoma came within a month of checking another one. Wow. It was so. I mean, she pretty much saved my life.
Nanette will show you her scar. She's shy, but we will show you the scar.
What was that we just saw?
Nanette will show you her scar because she's a very fit athlete and she's a biker, and she will show you because she's very brave. She wants you to see. Yeah. We want everybody to know that this is a serious cancer. And in fact, Dr. Tanzi doesn't let anybody out of her office without a mole check.
And Dr. Tanzi, you actually are a skin cancer survivor as well.
As well as an expert on it. So how did it happen to someone like you?
I diagnosed my own skin cancer, but not at first. I noticed a mole was changing on my leg over about 6 months' time, but I think, like a lot of people, I was in denial that I could actually get skin cancer. But the dermatologist in me realized that if it was changing, it would be dangerous, and it had to come off.
Can we show, because I don't think people know the difference between a regular mole and one that is cancerous. I think we have a split screen that should show us what an okay mole looks like versus, so which is which?
Exactly. On the left of the screen is a mole, and over 6 months' time, it progressed into this darker, irregular bordered mole. And what we talk about in dermatology are the A, B, C, D, and E warning signs of melanoma. Yeah. A is if it's asymmetric. If you put a line down the center of a mole, one side should equal the other side. B, the border should be smooth and even. If they're jagged, it could be dangerous. C, a mole should be all one color. If it's different colors, dark brown, light brown, white, black, that needs to be evaluated. D, if it's different. If you have a smattering of moles on your back, but one looks significantly different than the other, that could be dangerous, as well as E. E stands for evolving, which is another way of saying it's changing. Any skin lesion that's changing in size, shape, or color could be dangerous. And I tell my patients, really get to know your skin. If you're doing regular skin exams, you're going to pick up those earliest changes. Because melanoma, although is the Skin Cancer Foundation, according to the Skin Cancer Foundation, one person in this country dies of melanoma every hour.
That's unbelievable.
But if it's detected early, it has an almost 100% cure rate.
We keep talking about sunscreen, and I think Lucy's point is going to be
one of the things we have to say is reapply a jigger full for your body. That's an ounce. That's a lot. When they test SPF in the lab, they slather it on, and if you just put on a little, you're getting a tenth of what it says. Right. So people always say, "What's the best sunscreen to wear?" And I say, "The kind you will reapply." And now Neutrogena and all these great products make these lightweight formulations you will reapply. And Self will send you a little reminder. You can use your text messaging. Harvard did a study. If you get a text, you're 56% more likely to reapply.
Well, it seems like it just seems like we're talking about it more and more, and that's all you ever hear in the summertime is about applying and reapplying. It seems like we're hearing about it more now than ever. Is there less of it? Because of that? Because we're smarter? It seems like we're smarter now than we used to be.
Well, we're smarter, but there's still things out there that people need to hear about, the incidence of skin cancer, whereas many of the major cancers are better. We're seeing an increase in the number of skin cancers that are diagnosed every year.
But you guys are both okay, by the way?
Yes. We're detected in the earliest forms, and that's the bottom line.
And what about if your makeup, your foundation says it's got an SPF of 15? Don't just put sunblock underneath first, then
30. 30 and up will block 97% of the sun's rays, and you want broad spectrum. So look for 30 broad spectrum. Anything higher is a bonus.
Got it. All right, guys, thank you. Thank you.
Thank you
all
very
so
much. Hopefully we've saved some lives here today, ladies.
Great.
Thank you
Thanks
so
for
much.
having us.